Good afternoon. I'm Mandy Cohen, the Secretary of Health and Human Services for North Carolina. Thanks for joining us this afternoon. I'll start with a rundown of the numbers. As of this morning, there were 5,024 cases here in North Carolina in 93 of our counties. 418 people are currently hospitalized, and sadly, there have been now over 100 deaths. We're over 108 at this point. More detailed data, including demographic information, outbreaks in our long-term care facilities, and other hospital capacity details are available on our dashboard. Additionally, today, we have a new resource for people who need options for health insurance. Many North Carolinians are making tremendous sacrifices, and we thank them, to stay home and protect their families and communities. Some have lost jobs that provided health insurance or are no longer able to afford the coverage they had. Even if you are trying to buy health insurance for the first time, there are some options available. The easiest thing to do to explore your health insurance options is to go to healthcare.gov. That's healthcare.gov. When you enter your information in the website, it will tell you if you can enroll in a private plan or if you qualify for financial assistance. Subsidies are available based on how much money your household expects to earn for the entire calendar year and can make coverage more affordable. Most families will qualify for savings. For folks who newly lost their insurance, on healthcare.gov, they will qualify for a special enrollment period and will be allowed to enroll right now for coverage. Healthcare.gov will also tell you if you qualify for NC Medicaid or Health Choice. But because North Carolina is one of the 14 states that's not expanded Medicaid, in order to enroll in the Medicaid program, individuals must also meet requirements such as either being a child, a parent, or a family caretaker of a child under 18, a pregnant woman, or being aged, blind, or disabled. Sadly, many in our state do not have access to affordable health insurance, including those who are putting their health on the line every day during this crisis. Increased access to insurance coverage is something that I have been advocating for well before the start of the COVID-19 crisis. Those who work in grocery stores and pharmacies, our child care educators caring for our children of essential workers, our home health workers in nursing homes staying on the job, and even those without the security of having health insurance should they become sick. Well, access to health insurance is important to us all. It is extremely important for our communities of color who shoulder some of the greatest burdens of poor health in our state. We continue to see people of color disproportionately impacted by COVID-19. While African Americans are 21% of North Carolina's population, they are 38% of our positive cases and 39% of our deaths. These health disparities are long-standing and pervasive. They didn't start with this pandemic, but they have long existed in this country and our state. In almost every health measure, unfortunately, our communities of color are hit hardest during this pandemic and fare worse. This was a focus of my department before COVID-19 and must continue to be a focus as we respond to this COVID-19 crisis. One essential ingredient to building strong communities is access to quality primary and preventative care, and that starts with access to affordable health insurance. On the same note, we also need the federal government to take steps to support our doctors and other essential clinicians who serve our Medicaid patients and the uninsured in North Carolina. These providers need to be included in the financial support available through the CARES Act Provider Relief Fund. This morning, I sent a letter to Secretary Azar outlining North Carolina's request for support. $30 billion of that $100 billion fund has already been allocated to providers who see Medicare patients. We want to make sure that the next wave of allocated funding includes our pediatricians, our obstetricians, and other essential providers who see Medicaid patients and the uninsured. As we begin planning for our new normal, I hope we'll bring all the weapons we have to bear against this virus. Again, thank you for staying home to save lives. And with that, I'll turn it over to Director Sprayberry.
Thank you, Madam Secretary, and good afternoon. I want to start with some additional information on yesterday's severe weather. The National Weather Service has confirmed 7 tornado touchdowns in Alamance, Pender, Brunswick, Columbus, Onslow, Jones, and Craven counties. Meteorologists are investigating other possible tornado touchdowns in several more eastern counties. Utility crews have been working hard on power restoration, and about 30,000 homes and businesses remain without power. The largest outages are in Henderson, Transylvania, Mecklenburg, Anson, and Richmond counties. Please remember these important things if your power is out. Don't run generators inside your house or garage. The carbon monoxide fumes from a generator can be deadly. Stay clear of downed power lines and report them to your utility company. Use flashlights instead of candles to avoid the risk of fire. We'll be working with hard-hit counties to conduct preliminary damage assessments in the coming days to gather information to determine if areas are eligible for state disaster declaration. The State Emergency Operations Center has now been activated 36 days for the COVID-19 response. We pushed out supplies of masks, bleach, hand sanitizer, gloves, and disinfectant yesterday to hospitals, licensed care homes, and first responders. Many personal protective items remain in short supply, and we are distributing the supplies we get quickly to the facilities with the greatest need. The Restaurants Feeding Kids initiative is helping feed kids who normally rely on school breakfast and lunch to meet their nutritional needs. This program, coordinated by the Department of Public Instruction, is being piloted in Hertford County and is growing to Onslow and Carteret counties. It's a win for the kids and for restaurants who need the business while everyone stays at home. Food banks still need your help in keeping their shelves stocked because many out-of-work people are relying on food banks for groceries. Please consider a financial contribution or a donation of food to your local food bank. Visit feedingthecarolinas.org to find the website of a food bank near you. North Carolina 211 continues to remain available to provide critical information for people who need help with food, utilities, and many other needs. For twice daily information updates on coronavirus, you don't have to call. Just text COVID-NC to 898-211. You can get text in either English or Spanish. And as Secretary Cohen just said, if you've lost your health insurance, there are other resources out there to help you get insured again. Visit healthcare.gov for help. Please don't forget to look out for your friends and neighbors and call your loved ones daily. With your help, we're going to get through this together as one team, one mission, and one family. Thank you so much, and at this time, I'll turn it back over to Secretary Cohen.
Thank you, Director Sprayberry. As you can tell, we're focused today on making sure folks have access to the needed resources to fight COVID-19. And with that, I will turn over for your questions.
So reporters on the line can press 1 on their telephone keypad if they have a question. For our first question, we'll go to Steve Wiseman from the Raleigh News and Observer.
Hi, Dr. Cohen. I want to ask you about the number of hospitalizations jumped today by over 100, and I wondered if that was a sign that the virus is getting more severe, the situation is more dire, or is that just a matter of more hospitals reporting? What's the cause for that?
Steve, thanks for the question. So yes, the number of hospitals we reported today is higher than yesterday, and I think it's a combination of both. I think we'll need to see the trend over the next number of days to really know. But we have seen a dip in reporting from our hospitals over the weekend. We do report on our website the percent of hospitals who are reporting, and we have seen a dip over the weekend. So I think it's a combination of likely some low reporting at first from our hospitals. I hope to see that recover. And again, we'll be watching that trend closely as we move through the week. Thanks for the question.
Our next question is from Gary Robertson, Associated Press.
This is Gary Robertson. Dr. Cohen, this is kind of comes off of what Steve has asked. I mean, just looking at what seemed to be a pretty significant surge in deaths between yesterday and today, but at the same time, it seems like that the number of reported cases seems to be, flattening a little bit or slowing down. Can we take looking at it in the broader sense? I mean, is this a sign of, what is this a sign of, I guess, when you look at those numbers?
Thanks for the question, Gary. I think that's right. We continue to watch the trends of our numbers, both lab-reported cases day over day and deaths day over day. We know, looking at other states and other countries who are a bit before us, that you see a change in the case rate or an improvement in the case over case rate day before you see a change in the death rate. So I'm not surprised to see a bit of a lag in that our deaths are still a bit up while our case rates may be looking like they're slowing. What I am looking at, and others can look at with me every day, is how is our doubling rate going in terms of our lab documented cases? How many days does it take for us to double the number of cases, meaning going from 100 cases to 200 cases? How many days did that take? And then how many days did it take to go between 1,000 and 2,000, then 2,000 to 4,000? What you can see as you go back in time is that doubling rate is extending. And that's a good thing. That tells us that we're slowing the rate of acceleration. And it tells us that all the hard work we're doing to stay at home is working. We also need to watch that trend in our death rates as well. Those don't track quite as linearly as some of the case rates often do, and we're seeing in other states and other countries. But it's two metrics that we're going to continue to watch. I would say, mildly optimistic, but it is a day-to-day thing that we're going to need to watch trends here. And to go back to Steve's earlier questions, we need to make sure that there wasn't some blip around low reporting from the weekend to give us a false sense of security. We want to make sure that we're seeing a trend over the course of these weekdays as we go forward here. Thanks for the question, Gary.
Next question is from Helen Chickering with Blue Ridge Public Radio.
Yes, thank you. A question about the latest projection about peak dates. Is that still around April 22nd-ish window? And is that peak time, whether it's one day or several or more, consistent across North Carolina? Thank you.
Helen, thanks for that question. We've been getting a lot of questions about when is our peak, what do the numbers look like, I, like everyone else, want as much precision and on what's happening with this virus as we possibly can get. There are a number of models that are out there trying to predict different kinds of things. Some predict peaks, others predict how many hospital beds do we need. I'll remind everyone that, these models are not crystal balls. They're only as good as the data that we can feed into those models and the assumptions we can make. And given that this is all so new, these models are really hard to do. I don't think it means the scientists are not doing their best work. It is just that we're learning a lot as we go here. And so we have to take in a lot of different models. What I would say is that we're getting better at forecasting about a week in advance. I know that's not as much as folks would want, but as I look a week out, I do see a continued slow but continued uptick in the number of cases that we will see here in North Carolina. We do see some regional variation. We see some additional cases, and you can find this on our dashboard. We see cases rising in the Charlotte area, in the Triad area, as well as here in the Triangle area. So we are watching that from a regional perspective, and we want to make sure we're understanding if there are hotspots developing, and to, again, work with Director Sprayberry and the team to make sure that we have the medical resources we need. But right now, we continue to see a slow but uptick in the number of cases that we are seeing across our state, which tells me two things. One is I think that our efforts to stay at home are working. It is slowing the spread. But the second is that I don't see a peak at this moment in time. It doesn't mean I see a surge either. So I think what that is telling us is we want to continue with the stay-at-home efforts, to continue to social distance, to continue to follow those orders, to continue to wash hands and do all of those important things, making sure you're social distancing even when you go out to the grocery store, to the pharmacy. All of those things are working. And we'll have to continue to watch these trends over the next number of days and weeks to understand exactly where are we as North Carolina and a state, and particularly are there regions of our state that are acting differently than others that we need to respond to.
Next question is from Marina Aleman with Que Pasa Media Network.
Yes, thank you. This is Marina Aleman with Que Pasa Media. And Dr. Cohen, I'd like to know if you are evaluating the impact of the coronavirus in the Hispanic community, because we have some similarities with the African American community.
Marina, thanks for the question. I think important that our communities of color, the Hispanic community, the African American community, we know that there's long-standing health disparities in our system, and so I see those playing out in our current COVID-19 crisis. So the question is, well, what can we do about those? One is we want to make sure that folks have access to care right now, whether they have diabetes or high blood pressure. We want to make sure that those conditions are as controlled as they possibly can, so that when someone does get COVID-19, that they're in the healthiest place that they can be to fight off the virus. So that's number one. So that starts with the message for today, which was about insurance access. There are options for people to get access to insurance either through healthcare.gov or through Medicaid. I'd like to see even more insurance access options available for folks as we move through this. But that's first and foremost, getting folks access to care, not just when they're sick with COVID-19, but to work on all of those chronic diseases as well. And then as we think about how we respond, we need to make sure that we are doing whatever we can to reach out to various communities. We have wonderful folks who are not just doing our sign language translating, but doing Spanish translating simultaneously right now. Thank you to Jasmine and the Metavier sisters. We want to make sure that all of our information is getting out in English and in Spanish, and as well as make sure that we are reaching communities so that they understand the risks around COVID-19, how they can protect themselves and their families, and just making sure they're getting good information out there. So we'll continue to do that and work closely with you. Thanks for the question.
Next question is Jennifer Emmert, WLOS, Asheville.
Thank you for taking my question. I've actually got two, if I can. One, we've seen a recent increase in number of cases, particularly among the nursing home assisted living in Henderson County. Is public health watching that area and offering any other guidance to stop the rapid spread in those types of facilities?
Yes, I'll answer. I didn't know if you want to go for your second question, but let me answer about the Henderson and the nursing home. So yes, so when we hear of an outbreak, which is 2 or more cases in any of our congregate settings, whether that's a correctional facility or a nursing home, our local public health teams, and supported by the state, are working with all of these folks. We do track those on our website, so you can know that they are something that is on our radar. That means we're working with folks to make sure that they are not only following our existing guidance, but helping them with anything they need around training of their staff related to infection control and isolation procedures, making sure that they're wearing the appropriate protective equipment, that kind of thing. So yes, teams are working closely there, but I will say once a virus is in some of these congregate settings, like a nursing home, it spreads very rapidly. It is very, very hard to contain, which is why we're very focused on the prevention side of it, trying to prevent the virus from getting into these settings in the first place. So this is why we made some hard decisions very early on to limit visitors, limit non-essential folks going in and out of the nursing home, and now limiting things like communal space, which we know is incredibly hard and makes for an isolated experience for folks. But we're trying to do our best to protect people and prevent the virus from getting into nursing homes to begin with.
The other was we've been hearing. The other being we've been hearing from some parents who said they're afraid or they've kept from sending their kids to daycare or preschool because of COVID-19, but now they're having to pay the monthly fees in order to retain their child's spot. Have you heard any complaints, other complaints in the state with this, and what's the recommendation, or is there a financial assistance to help?
Thanks, Jennifer, for that question around childcare. This has been a very challenging place, but I think one where North Carolina has been a leader. So we know that many parents are keeping their kids at home when they're able to do that, but we also know many of our essential workers, our nurses, our folks who work in long-term care, still need to have their, they need to have childcare for their children so that they can get to work. For those folks, we have been able to stand up an essential worker subsidy program. So for our essential workers who need to continue to work, they are eligible for subsidies based on a variety of factors. If you go to our website, there is a form that families can fill out and bring to their child care setting of choice, and again, financial assistance available. So that's the good news. For families who are not using childcare right now, it depends on the setting in terms of how different ones are handling billing and whether or not they're asking families for additional funding as while they're not using the childcare setting. So we have asked and in guidance for folks not to be doing billing while the childcare centers may be closed, but different centers are handling it differently. But I will go back to financial assistance is available for our essential workers who need childcare during this challenging time. Thank you.
Our next question is from Rob Hughes, WCNC in Charlotte.
Hi, Dr. Cohen, just piggybacking on the nursing home situation, here in the Charlotte area, we've seen a huge surge in nursing homes affected, 67 cases at a facility in Cabarrus County, 91 new cases in Rowan County, most of which are coming from a single facility. Putting ourselves in the shoes of people who either live in these nursing homes or have loved ones at these nursing homes, how concerned should they be that they'll ultimately become sick if we're seeing nearly 40 outbreaks statewide? And is it the right thing to do to leave loved ones in these facilities right now?
Thanks, Rob, for that question about nursing homes. It was a little muffled, so let me make sure I got it right. But concern about family and how can we be sure we're protecting loved ones and what should families do? And I would say this has been a huge focus of our effort here, not only putting guidance out, but actually embedding those in executive orders saying these nursing homes must follow these protocols, again, because prevention is so important here, because you are right. Once the virus is in one of these facilities, it is very, very challenging to contain. It's possible, and that's why our local health departments, if there is an outbreak, work closely with the folks in these nursing homes to do the isolation, to wear appropriate protective masks and such, to close common areas, to really try to not have the virus spread. But as you mentioned, once the virus is there, it is very challenging. What I would say is that this virus is an incredible challenge. It is exactly why we're taking the aggressive measures that we are and doing some very hard things like limiting visitation to our long-term care facilities, but we think it's necessary to protect our most vulnerable. And I think that this virus, as you can see from our death rates, unfortunately is really impacting those over the age of 80, so those who are elderly and are more likely to be in these settings. So I know it it is scary for families who are out there. But what I would say is that risk of virus would be there if a family was able to bring their family member home as well, right? We know that if they're in a nursing home, it's because they have medical needs and challenges. So we know that they're going to be at high risk if they were to contract COVID-19. So I think it's going to be a family by family decision about whether they are able to even have their family member be at home with the kind of level of nursing care that they would need, or if they continue to connect with their loved one through video and phone and other mechanisms to support them there and help. We are trying to help those facilities, again, prevent the virus from entering those facilities in the first place. Thanks for the question.
Next question is from Holly Morgan with the Inquirer Journal.
So, Dr. Cohen, my news organization has had difficulty getting the names of nursing homes where possible outbreaks could be from state and local governments because of claims of revealing information about the identities of people who are at those nursing homes. Doesn't providing names of nursing homes seem like information readers need to know about? How can we better inform our readers about the nursing homes in Union County that have possible outbreaks?
Holly, thanks for the question. We want to balance patient privacy with the need for public health information to be in the community. And what we want to make sure is two things. One, know that there's no one going in and out of the facility itself other than the workers. So obviously all the folks who live at those facilities stay at those facilities. So it's really the workers, but we can't be sure that workers even necessarily, if they're from work in Union County, live in Union County. But so what we're trying to do is find the right balance of giving enough information like the county so you know that there is something going on in the county and folks can be aware, but not go so far as to concern folks related to privacy. So we're trying to strike the right balance. It seems to be where most other states have been in terms of reporting. Actually, I think we're reporting more by reporting the county level as well. So we're trying to find the right balance, and I appreciate everyone's wanting to know all the details, and appreciate you bearing with us as we try to strike the right balance of protecting some folks' privacy, but also sharing the information we can to share related to public health for the community. I think we've struck the right balance here with alerting folks about the outbreak and the county level without identifying the facility. But thanks for the question.
We have time for one more.
Okay, our last question is Chandler Morgan from WBTV.
Hi, Dr. Cohen. This is Chandler Morgan from WBTV in Charlotte. Quick question about some clarity behind how the decision is made when it comes to 2 being the number of people that's considered an outbreak. We've had a lot of concern from people on social media and viewers that 2 being such a small number could strike a sense of fear in that wording. So what is the standard that goes behind choosing 2 as the number 2 or more for an outbreak at one of these facilities?
Sure. Thanks for the question, Chandler. So this is a long documented way of calling something an outbreak. Well before COVID-19, we would be documenting what we would call an outbreak. And again, that's 2 or more cases in one of these facilities. So that is a thing that our public health teams or epidemiology teams have used for quite some time. I can get back to you whether that's defined by the CDC or what have you, but I'll say long practice for that. I appreciate that the word outbreak does sound extreme. That's why we keep defining it for folks. We're saying 2 or more cases. And so trying to help everyone understand what we mean when we define those things. And I think the important thing to focus on is that, we are trying to do all the prevention we can to make sure that the virus doesn't get into some of these more vulnerable settings like a nursing home, and to protect folks. I think, again, it goes back to why are we working so hard as a state, as communities, to stay at home? home, right? It's to slow the spread of this virus so that we can protect all of our communities, whether in nursing homes or other, because we know this virus impacts those at high risk, those that are above 65, those with chronic medical conditions, and they're part of our community, and we want to be protecting them. So we hear you. We know some of this is very scary for families and for communities, and I'm just so appreciative that everyone is working so hard to stay at home to help us to continue to slow the spread of this virus. So thanks for your attention today. Thanks for tuning in. I know we'll be back tomorrow with more information. Thank you.